For this video, we're going to do one of the most common procedures, which is the injection of Botox or Dysport into the forehead. Our patient today has had it done before, so her lines over the years have gone away, but this is how we maintain the results. Today I'm using Dysport, which is one of my favorite wrinkle relaxers. I find that it acts a little faster and spreads a little more evenly than the other filler, the other toxins. We're going to go over the three muscles that we inject. One of them is the orbicularis oculi. Go ahead, smile. That does the smile lines, which again, we've been treating our patient here for a while, so they don't show too much, and we're going to maintain them by re-injecting them. Go ahead, raise up your brows. The frontalis muscle is the other muscle we treat. That's the muscle that raises the brows, so you have to be a little careful not to over-paralyze this because you can drop the eyebrow. And then finally, frown for me. And then we treat the frown lines, which causes the 11s. Okay. And here we go, start. Inject into the muscle. And this muscle is pretty small and weak, so we'll just put a few units there. Now raise up your brow. We're going to start high to avoid dropping the brow. And then we can get lower once we get to the middle. The injections are done with a 31 gauge, relatively tiny needle. Still stings a little bit. And finally, we're going to treat the frown line on this side. Go ahead, frown. And one last drop. And then we hold pressure and then ice. The effects of the products take about 4 days to start working, maybe about 10 days to see the full effect. It has to be maintained usually every 5 months or so is adequate. So here we're going to demonstrate the lip injections as well as nasal labial folds and marionette lines. So basically we're working around the mouth area. The plan is to put a tube of Versa lips into the lips, and we're going to use another tube of Versa into the nasolabial folds. These can be interchanged in a very similar way with Juvederm and Restylane. There's a lot of hyaluronic acids that are available now. We're going to start by injecting on the outside, so we're going to do the marionette lines here and the nasolabial folds, and then work towards the center. Some of the numbing from the outside will help numb up the lips, and that's why we start with this order. If you've seen my videos before, you'll know that I like to use blunt cannulas, which is a nice way to inject the nasolabial folds. The cannula is blunt, meaning it wouldn't go through the skin, so we have to start by putting in a needle, which my assistant will pull. We're going through the same little hole and start pushing that crease outwards. The reason I like Versa is it's a great filler, but also each tube of Versa is 1.2 cc's of filler, which gives me a little bit more opportunity to make a correction without having to get too expensive for each patient. Now I'm injecting the marionette line. Which evens out the jawline and is an important part not to neglect while treating the perioral area. Again, we're using a cannula, so we go slowly. That's going to be different than the lips. The lips will inject with a needle. Yeah.